Associate Professor Sam Hocking.
Hello, everybody. Thanks for having me join today. And I'm specifically going to be speaking about access to specialised obesity services. And I'm sorry that I wasn't here to hear all the other speakers before me because I've been working in a specialist obesity service clinic this morning and just finished seeing my last patient. So I've only just been able to log on the call just in time to speak. So as you've probably already heard this morning, and I heard Teresa allude to it, one of the issues for people living with obesity is that it unfortunately disproportionately affects those who have the lowest access to care and who can least afford care. And this is particularly pertinent when it comes to medical care for obesity, as we've just heard mentioned by Teresa. So one of the issues is that very few obesity treatments receive any form of government subsidy. Multidisciplinary care for obesity is obviously incredibly important. We need the involvement of an allied health team, including dietitians, exercise physiologists, psychologists, many other members of this team. There is a provision for some subsidy to access these services in primary care using a chronic disease management plan, but unfortunately this only provides a very small medical rebate of around $63 for only 5 allied health visits a year, and these visits cost an out-of-pocket cost on top of that, varying between $50 to $200 an appointment. So for people who are struggling financially, this is often out of reach. The other issue, of course, is access to medication. We're now very lucky to have 6 registered anti-obesity pharmacotherapies available in Australia. But again, none of these are subsidised through the pharmaceutical benefits scheme. And the cost for these medications ranges from $88 per month out of pocket to as much as $700 per month out of pocket. So again, at a very high cost to the person living with obesity without sufficient subsidy. When it comes to specialised obesity services, there are a number of specialised obesity services in public hospital clinics around Australia, but unfortunately, these are located only in major metropolitan centres. So for people who live in regional or remote areas, they're often out of reach. There's also a lot of variability in what is offered through these specialist obesity services. So not all of them have the allied health support that others do. And so there's some inequity then in access. Not all have access to bariatric surgery. One of the problems with such a limited number of specialist obesity clinics is that waiting lists to get into these clinics are very high. Often those waiting lists can be many years. And to try and limit the number of people who can come to the clinics, to limit the waiting lists, sometimes the entry criteria are very strict, which means that unfortunately people are only able to access these specialised obesity clinics when they become quite unwell and they're therefore quite end stage with their obesity before they're even able to access care. So I think this just highlights then the problem that Teresa's already pointed out in primary care. It's then compounded with this inability to access specialised tertiary obesity care. Now, I haven't said next slide because I think there was an issue with my slides uploading, but if you just try the next slide in case there is something there, I don't think there will be. No, and then I'll finish and I'll hand over to Alex, who's going to talk about the bariatric surgery perspective. So thanks very much.